Good morning and welcome back to our next episode of InMode's educational live stream series. We're particularly excited to be here in Dr. Jennifer Tsai's beautiful Hudson Yards, New York City office. She's a founder and president of Line of Sight, the premier optometry practice here in the West Side and all throughout the city actually. Dr. Tsai, thank you so much for being here in this wonderful office.
Thank you for coming.
Thank you. She's a key opinion leader for InMode as well as having a thriving practice. She is a nationally recognized speaker for her areas of expertise. Today we're lucky to have her talking about InMode's Envision, which is a new technology, and it's beyond my pay grade to understand, so I'm going to let Dr. Tsai explain everything. As usual, we have Lisa, our co-producer here, and Shannon Birch, who's our director for InMode Clinical, and Brave Makers, Justin Ross and Ryan Windes. We also want to pay particular thanks to Dr. Tsai's patients who are really the stars of the show. We thank them for their time and consideration. Without further ado, Dr. Tsai, please tell us what you plan to do today.
Yeah, so I'm excited to talk about everything that I think, whether you're in optometry or a different specialty, everyone wants to know, how do you grow your business? How do you use personal branding and make it savvy so that you can grow organically, and how to really scale the business and bring in revenue and using the latest technology that InMode has to bring.
Amazing. Well, without further ado, we'll let you take it away. Thank you so much.
Awesome. Okay. So I'm going to start with talking about how to grow your business, and really, again, the focus is on branding and technology. And I'm really excited about this because it's one of those things where, you know, once you get started, that taking that first leap is the biggest step. And I will have to say, 6 months ago, I took a leap of faith, and I had to make one of the hardest but most rewarding decisions of my life. And I'll get into what that is in a bit. I just want to go through a run through of what the agenda will be today. I'm going to start with sharing a little bit of my story and my background and branding and marketing, and we'll move on to building a dry eye aesthetic clinic, what that means for me, and dry eye technology and the new Envision device by InMode. And we'll go into protocols as well as tips that I have and that I found that it's worked for me when I see patients in doing the treatments, as well as some before and after images. And then we'll also see some live demos with my amazing patients that I've been treating, as well as the last thing is, most importantly, road to successful ROI for your business. So a little bit about who I am and how I started. So I'm an optometrist in New York City. I started wearing glasses before the age of 10, and I remember just my parents picking out the first pair of glasses for me. They were these huge, round, thick glasses. I was not a fan of them. It was definitely boyfriend repellent, but you know, it really got me introduced into the eye care industry, and I quickly wanted to get out of glasses wear. So going into high school, I was so eager to get into contact lens wear, and of course, anything that could possibly go wrong to me did happen. And so a couple weeks in, I slept in my contacts, and I ended up with a huge corneal ulcer that was almost visually threatening. So I almost lost my vision. And again, shortly afterwards, getting into college, I had undiagnosed, I found out later going into the optometry's office that I had bilateral retinal tears. Some of you guys who are in optometry and ophthalmology know that that is also very scary for that to happen to you. So I figured, you know, what better knack than to go into optometry for me. So that's why I decided to choose optometry, because I realized, most importantly, how important vision is, because it's the first thing you use when you wake up and it's the last thing you use when you go to sleep. So I started practicing in different clinics, moving to New York City. I was at Mount Sinai in the corneal and refractive department. I also moved into Brooklyn Hospital Center for retinal disease. And I realized, you know, I thought that there was something that was lacking. There was this unmet need. For me, it was providing personalized treatments, and I saw such a heavy rise in dry eye disease. I wanted to find a way to integrate holistic wellness and find preventative ways to improve health that was non-medicated and non-surgical. And so after, you know, looking around for a location, shortly after, I would say, you know, 5 years in, we found a perfect location in Hudson Yards and opened Line of Sight, which I'll get into in a bit. During that time period in between, I also started an eyewear company called Carrot Eyewear. It was focused on online e-com eyewear glasses. At that time, I didn't find a pair of glasses that I felt like I could recommend to my patients that offered adequate blue light coating protection that was fashionable. And so that was a way for me to get sort of into business and learning how to manage a business, although it was online versus brick and mortar. I also now, just from my experience, has become a healthcare consultant and an advisor, and also an adjunct professor at my old school, which is Salus University, and content creator, which I will also get into, and a speaker. So this is a little bit about me I wanted to share with you guys. So again, I specialize in dry treatments, and I want to focus on holistic wellness. That includes ocular aesthetics and also non-surgical vision corrective methods and treatments through various types of lens and designs. It's founder of Line of Sight, and it's a concierge eye care practice that's focused on integrating holistic wellness approach into eye care in the heart of New York City in Hudson Yards. I regularly advise as a speaker for different companies, some in the eye care space, including Bausch & Lomb, Zeiss, VSP, Tarsus Pharmaceuticals, and Envision Council. And I contribute on TV as an expert, and I've been featured in Fox, ABC, as well as Lifetime, and Good Day New York most recently. And focused in article contribution, so as a contributor for various magazine articles, including Vogue, as well as Lore, also Women's Health, WWD, and 17. And last but not least, really sharing my passion online, my passion on eye care on social media, on my page, Dr. Gin and Juice. You know, when I started about 5 to 7 years ago, initially the focus was, I started off honestly as a travel blogger, and it was just a passion of mine. I never incorporated my healthcare professional into it. And for me, at that point in time, it was fear of judgment, being worried as a healthcare professional that my patients or people would see me differently. But shortly after, I decided to incorporate all that information in there, and it has done two things. It has brought me closer to the community because I realized that other people experience the same sort of inner fears about being able to put themselves out there. But the second thing it has done is actually brought me business organically, and it's really helped me actually show myself and my personality what it's like to be a doctor with a patient, the bedside manners naturally, and social media has significantly done that in a way where I have not paid, to this day, spent $0 on any type of advertisement spends or marketing materials, no email ads or anything like that. And I was named 2021 Entrepreneur Honoree for Forbes Next 1000, and also 2023 Small Business Honoree on Chase's Small Business. So I'm going to start getting into social media. For those of you who may or may not have it, I want to talk about why this is important for your business and for personal branding. And we can think about it in two sort of junctures. We can think about it as your personal brand and as your business brand. So for me, I wanted to separate the two. Part of that reasoning or the thinking behind that is when you grow a practice or a clinic, you want it to sort of stand for on its own. If you have different clinicians that come in and different doctors, you want to be able to build the business around them as a brand and focus on them. And my personal page stands for what I believe in and what I'm doing in education, but the two can oftentimes be intermingled. So I started on Instagram first, 5 years to 6 years ago, like I mentioned. At that time, started off with maybe let's say 100 followers. Most of them were my friends. And eventually grew it to a point where it's now around 228,000. And I have a combined following across YouTube and TikTok and Instagram of over 400,000. And I will tell you guys, it was not easy to get to that point. And success is never overnight, but it takes starting somewhere, and it means trial and error. So when TikTok came out around the time of the pandemic, I immediately jumped on. So again, just like there's new technology with InMode, you always want to figure out what the newest technology is in social media or different verticals to grow your business organically. And YouTube is great if you're focused on more long-term content. So there's just different ways to approach it. Just a quick, tidbit on tips on growing social media. When it comes to Instagram, it really is showing a lot of your personality and sharing, things or information about your education or the things that you want to let people know about your services or your products and your practice, whether it's related to eye care. We sell eyewear. We have inventory, but also any treatments or services that you offer. Or the latest thing that you bring on, latest technology that you bring into your practice. When it comes to TikTok, I would say it's a different approach. It's focused on more quick and trending audios and quick and trending viral reels that you want to hop onto. So oftentimes it's finding a trending audio or sound or voiceover and making it relate to what you're doing in your practice. And when it comes to YouTube, again, focusing on long-term content, it's something that stays there that people can look up, later on. If you want to talk about dry eyes, you can get into the nitty-gritty and talk about the details in that, and that will stay on your channel for a very long period of time that people can find later on. And if you guys want to follow me, my personal page is Dr. Jen and Juice. That's the same for across all 3 channels. And for Line of Sight, it's Line of Sight Vision. I got into this earlier, which is about why branding works. And the first thing is sharing your services and products. It's a great way to share in your stories about all the products that you brought in. For example, if we have a new frame that's popular, that just got released, that's limited, it's a perfect thing to just sort of throw that into the social media page on our practice story. Gaining traction, if we threw most recently a couple days ago a Dior event, making it exclusive and allowing invites to come in and letting patients join to be part of that community. And I think that really is what it is. It's creating a community that allows others to see what you offer naturally, but also letting them know, so by the time they come in for that exam, they already know what services or new technology that you have. It's not sort of starting over and re-educating, and they're not sitting in your waiting chair for too long watching an ad, figuring out what you offer in your office beforehand. So they already see your page, they already know what you do, and they already know what technologies they might be interested in. And the second thing is being seen as an expert. It's very critical to be seen as an expert in what you do, because not only is it important for the patients and customers, but it's also important for other healthcare professionals in your community, the local community that you're engaged in. So, for us, it was bringing awareness, making connections, and networking with the dermatologists in the area, also the ophthalmologists that we refer to, also different nurses, estheticians, as well as PAs. So, having that rapport is really important, because being seen as an expert, the first person that they think of automatically is to send that patient to you because they've thought of you through your personal branding. The third thing is attracting employees. It's so important to attract the right employees. And for those of you guys who are currently practice owners, you know how hard that is. And building a brand that you're passionate and believe in, you want to spread that and delegate that so others that work with you, your team, also holds that same value and that same culture. And so attracting the right employees through your social media and through your branding means you'll bring the same like-minded people into your practice to work for you, versus ad placements or sending out job offers, things like that. The last thing is driving conversions. So what that means is, like, really when patients do come in, being able to sort of either considering if you guys have an online portal to sell any products or services that you offer. I know some places have eyewear. They might sell the eyewear online. Or if you offer different types of services or skincare beauty products, it's something that you can sell automatically on your online shop. But most importantly, when they come in, and we'll get into this later, but if you're doing treatments, first you're starting with maybe IPL for dry eyes, but then later on you talk about radiofrequency or you have Morpheus. These are great ways to bring patients back for recurrent sales and drive the business forward, as well as have them refer to other patients. For us, we grew organically for what has been the most important thing is word of mouth, patients telling their friends and family members. I would say the second thing is online reviews, making sure that is up on your page or whatever sources that you guys use for booking. And the third thing is, again, your personal page and branding and website. And just the last thing or takeaway about this that I have is just, if you can imagine this, in the time that it takes for you to reach one customer in your exam room, you could be reaching many more customers passively without having to do anything. So you've just expanded your reach within the same amount of time to reach way more patients passively. I'm going to go into line of sight and talking about why I chose to start my own practice and what it means to build a personalized experience. I felt like there's an unmet need in the eye care space, which is a patient is not the same. So how could their treatments be the same? And for me, that meant in order to do so, I had to build a personalized or tailored office to be able to offer the range of what I thought the treatments would be for that patient. And so, We looked for a location. That was in 2019. Towards the last month of 2019 in December, we found a location in Hudson Yards, which I believed for me and this community embodied what I believed in, which is promoting preventative health and wellness. And so the main four important things I knew that I had to have in my practice were these four, which is being able to offer comprehensive and medical eye care exam and being able to integrate ocular aesthetics, because to me it made sense. The skin around your eye is a very delicate area, and who better to take care of that than an optometrist or an eye care professional. The third thing is state-of-art technology. There's so many new technologies, just like in business or in startups. There's always a new thing coming out, and you want to be at the forefront of that technology to make sure that you're the one that people think of when they look for a doctor to provide that services. You don't want to be the doctor who, when they come in, they say, well, how come I heard about this service or this treatment from another place, but you never mentioned it? So that was very important to me, to have the best technology possible to give the best quality of care. And the last thing is creating a beautiful experience in a serene space, focused on making sure that it's intimate, it's comfortable. Patients are sitting in the comfort of their own home, like in a living room space, and sort of wrapping that all into one. And so came up with Line of Sight. But I have to tell you guys, again, success never comes easy to me. So this is just a little personal story about how I started. The first image was when COVID hit. So again, December 2019, we signed the lease, started the build out, and in March 2020, we were expected to come close to finishing the practice, the build out. And obviously I competed for the anniversary date for my launch date with COVID, and March 2020, New York City and the rest of the world just completely shut down. And I'll just recall a moment that I remember. I remember coming here, and we were with like 8 construction workers building the place out, super excited. There was so much energy, and I read the news, and we kind of knew it was coming, but we weren't sure what was going to happen. And I would say within the end of that week, we were down to 2 and then 1 construction worker. By the end of the next week, there were none. And here I am. We just took out $500,000 in loans and my own life savings as well to start this practice, and we couldn't do anything. We couldn't even build it out. And so I just remember us carrying loads and buckets of like frames and inventories and figuring out ways to make makeshift. How do we make this work? How do we pivot the business? We started designing our own temporary cabinetry for frames, and staying here till like 3 a.m. getting this place built out. And so the third image on the right is when we did not have any construction workers, and it was just us, me and Jonathan, in the space really trying to figure out how to make this work. And how to pivot. The first thing I did was start with seeing patients virtually online and being able to figure out quickly like what platform I could use to be able to see patients with that. And so again, this is to highlight the pivotal moment, because at some point for you as a business owner, you're always going to be hit with a situation where you have to make a decision on what to do. And no one else is going to know the answer but you. And you're going to be the one that has to decide if this is right for your business. And that decision for me in that situation was, here I am with COVID, everything's closed, no one's buying eyewear, no one's going to spend a dime on luxury eyewear that we're selling. So do I want to pivot my business to focus on medical insurance-based care, where I'm seeing patients purely through insurances, medical care, using vision insurances and bringing patients that way? But that meant that I had to see a higher number of patients, higher quantity, which meant my quality would drop. Or do I consider the second option, which is I wanted to focus on creating a dry eye concept. And that was because I saw an unmet need that was missing or lacking in the industry. And I knew that this is something that they needed. And if I just focused and continued that eventually that would be the best decision. In order to decide, I figured I kind of have to stick to my guns, which is defining the new standard of care. And that's what I truly believed in, because if I stuck to that, that means everything else will come. And so I decided to continue with option 2, which is to build out the dry eye clinic. And here are some images that I have of Line of Sight. The renderings were before, and this is now how the place looks, and the social media page for Line of Sight Vision on the far right. And it took from us going from 2.5 years ago, I had 0 patients. and then I went to, let's say, 100 patients virtually. And then finally, by the end of 2020, beginning of January 2021, we were able to finally open the doors for our patients. And now to this day, we've grown to like 8,000 to 9,000 patients starting from scratch, from zero. And that just goes to show that if I'm able to do that and the worst times possible, you can too. And that partially is with the help of bringing in the right tools and the technology and sticking to what you believe in. And knowing that you have an asset or something that you can use to pivot or also bring in a second stream of income and also bring the best treatment to your patients. I'm going to talk about dry eyes and the unmet need that I was referring to. Just based on statistics alone, we see that 16.4 to 25 million people are diagnosed with dry eye. That is huge, and this number is growing. Children now are using electronics to study at an earlier age on iPads, so children are actually experiencing dryness at an earlier point in time. Those who are getting LASIK done, more common. Those who are dealing with more autoimmune or inflammatory disease, that's more common. Those who wear contact lenses more. Changes in pollution. Most recently, we had the wildfire and the smoke coming into New York City. That affected our eyes. So the environment, what we're doing, our lifestyle, everything is causing an increase in dry eyes. And so that's important. Also, we know that 6 million people are symptomatic but undiagnosed. That's huge, right? So if only 6 million people are symptomatic but they're undiagnosed, what does that mean for the people who are undiagnosed? That means there's so much potential for a business to grow and for you to be able to help your patients this way. And the last thing is just seeing the numbers are astounding. It's a $3.8 to $6.6 billion dry eye industry when it comes to technologies and treatments and services. And what we'll get into later is just knowing that some of the existing treatments modalities may not be as helpful for our patients in providing the care that they need or the outcomes. So we're going to talk about identifying your dry eye patients and figuring out how do you know who to talk to and what are the factors to point out or look for when you're seeing a patient in the exam room. And the first thing is understanding when you're seeing the patient through a slit lamp exam or observing them through a photo or looking at them in person, their tear film appearance. How does that look? Are their eyes swollen? Is there edema? Are their eyes red? Do you notice capped glands? Do you see actually an oily tear film? Do you notice SPK on the surface when you stain their cornea? Or do you just notice or observe while they're talking to you or chatting to you that their eyes seem to water a lot or tear up a lot? Because again, a lot of patients, as we saw, they may be symptomatic, but they just don't know. And now the most common one I would say, here are some tidbits, is when they're doing the refraction and they aren't able to figure out which option is more clear. They switch back and forth during refraction, option 1 and option 2. That is a huge sign of dry eyes. So a blurry refraction is oftentimes a key indicator of dry eyes. Someone that sits in your chair is constantly blinking. There are other questions that I asked in the exam room, such as when you walked on the way here this morning when it was windy or sunny outside, did you notice that your eyes watered a lot? Most people don't realize that when their eyes water outside, that's actually a sign of dryness. There's oftentimes like internal factors that we learn in school, which is age, autoimmune disorders, Sjogren's syndromes, thyroid disease, but also hormonal changes. As certain changes, if you start like hormone therapy as we get older, things like that can affect intrinsic changes, diets as well. External factors, this is a huge one. So external factors, screen time uptake has gone up. So we know on average, when we stare at a screen, our blink rate reduces by at least half. And what happens is our tear film either evaporates, breaks apart, it's disrupted, there's a loss of ocular homeostasis. Lifestyle changes, staying up longer, not sleeping as much. These can also affect the eyes. If you go to the gym, you work out a lot, you sweat a lot outside, and it's sunny in the summer, that can cause issues with dry eyes as well. Ladies wearing makeup, lash extensions are huge, waterproof eyeliner, makeup, mascara. Medications, certain medications that you can take, Accutane, antihistamines, certain anxiety and antidepressant medications as well. and getting surgery such as LASIK surgery that we've seen, PRK for example. We definitely talked about environment. That includes like hobbies, what they do, right? So if someone is a cyclist, they're oftentimes outside spending time, or someone that skis a lot or is in a colder climate, lower humidity, that can often cause dry eyes. And contact lens wear. To understand really how to simplify or break down dry eyes, I would think about it in two perspectives. There's really evaporated dry eyes, and then there is lack or tear deficiency. So meibomian gland dysfunction affects the meibomian glands that produce oil. The tear film is made up of three components, and the first is we have the aqueous, which is the water layer, and then we have the meibomian layer, which is to produce oil, and the last one we have is the mucin layer. And now all three layers are critical because it creates this nice coating. Think of it like a windshield wiper. When you turn on the windshield wiper and you have adequate fluid, you're keeping the surface clean and moist. But when that breaks apart or it's smeared, it's not going to be clear and it's not going to be comfortable. So 85% of most people actually have this type of dry eye disease, which is meibomian gland dysfunction. Why? Well, the first thing is these glands sit on the outside of your lid, right by your lashes. So if these are tiny little pores that produce fluid or oil, and when you blink, just like a windshield wiper, when you blink, the action or method is to create the spread of the tears, mixing it with the aqueous component to create a nice tear film. It's a very common place for it to get clogged, whether it's you touching your eyes often, if you're sweating, if you're working out, like we mentioned, if you're wearing makeup. These glands over time get disrupted, and when inflammation sets in, the cycle gets disrupted. Those glands can't function as normally. So we see globally 35.8% of people have MGD, and that's globally. But that means if you sum it up, that's 2.5 billion people. On the first image you see on the left, that's someone with nice, clear, liquid form, transparent oil that we would like to see. Now, what happens is when they get clogged, just like whiteheads, it can turn into this more viscous, thick, I call it like buttery type of oil. And now, when it goes on for too long, in the last image you see, it turns into this like stringy yellow cheese. And if you can imagine at that point, you're absolutely not making any oil at all, and there's no lubrication on the eyes. So you can imagine if your eyes are watering outside, why does this cause dry eyes? You aren't making adequate oil or tear film to lubricate the surface. The second most common ocular surface disease that links to both meibomian gland dysfunction and causes dry eyes is blepharitis. Blepharitis is buildup on the lid margin, which is oftentimes related to inflammation and bacteria. So most commonly, most people don't know that they have Demodex mites on the surface. That little creature at the bottom is a Demodex mite. We can grow that everywhere in our body, especially for patients who have rosacea on the cheeks. But Demodex mites can lay on the surface of right where your lid margin and your lash margins meet. And so when it goes into overdrive, I tell patients often, it's oftentimes like you go to the dentist and you know that you might have plaque or buildup on your teeth. And you know to go in to get cleanings done to remove that plaque and that biofilm that's there. But if it sits there for too long, it can eventually lead to a cavity. But why is it important to clean that up, be preventative before it gets to that point? Because you don't want it to get to a cavity, because when it gets to that point, you lose a tooth, it's too late, and it can spread. So blepharitis is something that can cause symptoms like itchy eyes, swollen lids, redness, irritation, blurriness, and as you can see, because it's right by those glands, it can also clog those glands and cause an infection. 37 to 47% of people have signs of blepharitis, and 57.7% of people are diagnosed with blepharitis who have dry eyes. So if you see someone with a rosacea on their cheek, definitely look for blepharitis and signs of that in lid neovascularization. We're going to go into existing treatments and their limitations. And this may be something where in the practices that you're currently at or looking to do, or may have heard about if you're outside of the specialty of eye care, you have seen to be tried or true, or what you've read in the journals or in the books that we used to learn in school. The biggest one is baby shampoo. baby shampoo just does not work. And we learned that, it's in our textbook. We were taught to use baby shampoo to clean the lids if there's buildup on the lid margin. And we just find that it doesn't work. If anything, putting baby shampoo in the eye, the ingredients actually, because of the foam, causes a foamy tear film in the long run. And that causes more irritation for the patients, and it creates this foam-like texture when they start producing more tears. And it just comes back anyways afterwards. Omega-3 supplements. Omega-3 supplements, while it's great for someone's diet and health, I wouldn't say necessarily work in a way where you're getting closer to the root of the issue and finding a way to address it. For example, omega-3s aren't going to help if there's blepharitis or buildup of bacteria on the lid margin. It's not going to help if there's already existing disruption to the tear film and there's already existing inflammation. Warm compresses. This is something that we all tell our patients to do when they go home. We say put a warm towel on the lid, and we say, or fill a clean sock with rice and put it in the microwave and put it on your lid for a little bit of that added heat. But it's just not enough heat. From the literature and studies that we know, we need to hit a melting point of 43 degrees Celsius at a consistent time in a uniform targeted spot for those glands to melt. And so warm compresses just don't make the cut. Artificial teardrops. I think it's great. It's a great temporary fix. Oftentimes what happens is patients put it in and 5 minutes later their eyes are dry again. And so I tell patients it's often like you're putting lotion on your skin, but what's happening underneath is your skin's still dry. And we need to address that issue instead of masking it with putting on artificial tears. Punctal plugs, very, very common, very, very popular. Punctal plugs can either be made of collagen or silicone for permanent plugs, and they go into your tear duct to help prevent the drainage or slowing down the drainage. Think of it like putting a plug into a sink. When you do that, the water doesn't drain as quickly, so it's helping to retain a little bit of your tear reservoir. So, I used to do plugs a lot more frequently in the past up until other treatments were available. But I've had my fair share of experiences just from what I've noticed in my exam room. I've noticed that it's actually kept, when it comes to silicone plugs, a component of inflammation in the eye. So we're not getting rid of the toxins. Naturally, your tears are made in a way so that it lubricates your eyes. That's the first function. The second main function is that it's supposed to get rid of any bacteria or buildup or pollutant that comes in the surface of your eyes and sort of drain it down your punctum into your sinus to get rid of it. And if it's plugged, right, we're keeping that toxicity on the surface of your tear film. And not only that, I've run into situations, this is my patient here, where these plugs were replaced by another provider a couple of years ago, and she rubbed her eyes and the plug punctured through her conjunctiva, and that's scary. We had to figure out a way to sort of break that apart, pull it out, but now she's left with an enlarged tear, punctal hole that isn't going to, work adequately like it should. And so there are situations like this where, again, I feel like it's not, the risk versus the reward, it's not necessarily always there, or it's just not long-term in terms of solution. Cyclosporin drops, Restasis, they are very expensive, and it doesn't, again, address necessarily all the problems like meibomian gland dysfunction and blepharitis. You think of like Restasis or Xiidra. It definitely helps with inflammation if someone has autoimmune disorders or Sjögren's syndrome or thyroid disease, but patients people are busy. They don't remember to put in drops consistently in the morning and at night, and the drops take about 90 days for it to kick in, for it to work, and they're expensive. There's these tiny little bottles, sometimes they overdrop themselves, and what just ends up happening is that patients aren't left with a long-term solution that's going to help their issues or address their problems. But again, depending on what type of condition that's causing their dryness, it may be helpful. And the last thing is heat-based expression. Some examples are Lipoflow or Ilux, and it uses heat base to address the glands and the clogging. They are expensive for the patient, and I would say you end up having to repeat the treatments. And again, because it doesn't address inflammation, all you're simply doing is it's a glorified way to provide a better outcome compared to a warm compress. But you really, again, want to address the inflammation on the eye. In order to do so, you want to focus on other types of technology. So Envision, Very, very exciting. And we talked about how 6 months ago I had to make the hardest decision, but most rewarding decision of my life, and that was to bring in Envision. For me, why was it a good idea to bring on a brand new technology, rather expensive, into my practice when I just opened about 2.5 years ago? But I saw, again, that need, something that I could offer in my toolbox for dry eyes that provided better benefits, could make my patients happy. And so the Envision was it. It's a 3-in-1 solution. It has the Forma eye for radiofrequency, the Lumecca eye for IPL, and then you have the Morpheus 8 microneedling radiofrequency. The biggest reason is that it is non-surgical, it is non-medicated, and it provides a dry alternative treatment for meibomian gland dysfunction. Like I said, the treatments that we talked about, drops or surgery, patients do not love the idea of having to put in medicated drops if they don't have to. They don't want to think about having to get surgery if they don't have to. So this has been amazing and revolutionary to be able to offer this now to my patients and help them both with their dry eyes but also with aesthetics. And I love Envision because it's actually designed in a way where it's easy to use around the eye region, and it's made for the eye region, and simple enough to also use by changing different tips and surfaces to focus on the face, if you want to add on to that. The other thing is that there's no consumables. When it comes to the radio frequency, it's a bipolar tip. There aren't consumables, there's no grounding pads, you don't need shields. When it comes to the IPL, really there's also no consumables, you're not being charged for tips, and that's the other amazing thing, because that pretty much adds up when it comes to owning the device. Not only do you pay for the device, which is expensive enough, you also have to pay for consumables as well. It's multifunctional, as we mentioned. You can use it for various parts of the eyes and the face, and little to no downtime. For my patients in New York City, everyone's very busy. They have somewhere to go, they have to go back to work, and they can't afford having downtime where it requires them to avoid working or having to call out of work for a couple of days. And so being able to provide these treatments where they can immediately just go back to work is amazing. And again, my clientele might be different from yours, but I have to say, New York City, we have a range of clients that come in. I would say they start at the age of 20, 50, but how are we able to provide a treatment that even those in college or still in school are interested in being able to get the treatment done? And that has to do with the fact that you're providing them with a preventative approach, a holistic approach that helps to improve everything and address their issues for the longer period of time. And the other thing is, it's very versatile across different types of skin types, and it's very versatile across all different seasons. So skin types, we may not be able to do certain treatments such as IPL on darker skin types 4 and 5, African Americans, and darker Indians, darker Asians, for example, but we know that we can use radiofrequency on them. So at any point in time, I always have a toolbox that I can use for any patient that comes in. Seasons, in the summer, certain treatments like IPL, they are darker and they tan a lot. We may not be able to offer that treatment to them, but we know that with radiofrequency, I can do that. And again, the last thing is for your business, being able to bundle the treatments. So when a patient comes in, being able to offer them one treatment, and if that doesn't work or address their issues, being able to switch to a different services on an Envision device, or being able to do a combo for both of them. And so that's not only going to help your business grow in terms of ROI, but it's also going to help the patient in the long run for their symptoms and their dry eye relief. This is just a little bit of information about radiofrequency and how it works. So radiofrequency delivers high frequency of electrical current to the areas that you're treating, and the goal is to really uniformly bulk heat the area as well as cause neocollagenesis. And so when we are able to do that, we're able to melt those clogged meibomian glands that sit in the dermis layer. But with neocollagenesis, we're able to contract and stimulate collagen growth. So that is definitely going to help with fine lines and wrinkles, crow's feet. We talk about like dark bags and circles, and that has been a significant improvement for patients. But when it comes to aesthetics, you can focus on the levens and the smile lines. So sometimes for my patients, if they're interested in bringing that on, we do that as an add-on. Why did I specifically choose radiofrequency from InMode's Envision device? First thing is, I did my research. It's a bipolar handpiece, and I knew that it made sense. I remember just a year ago, I didn't own an InMode device, and I went to one of the events, and I just sat in the audience, and I learned about the radiofrequency technology, and I knew how advanced InMode's technology was when it comes to radiofrequency, and I knew at some point in time they would enter into the eye care space, and when that happens, I again wanted to be at the forefront of that. And what happened was 6 months ago they did, and the bipolar handpiece is amazing because, again, there's no consumables that are involved with that. It is controlled in depth and where it delivers that energy. It's very safe, especially when you're treating the delicate eye area. And it's also very easy to use. And so those are the most important things to me, not having to have a grounding pad or being concerned about the depth of the control. It's designed for the eye region, and you can see in the image there that we shot that it's a very precise handpiece that I can easily fit around the top upper lids and the bottom lids as well. Very painless. I tell patients it's like a hot stone massage around the eyes, a total of 20 minutes, but it feels very soothing, it's very comfortable, and we can control the amount of energy that we want to deliver, which is great for depending on someone's pain tolerance. If, for example, on an IPL, I can't go high in energy based on their skin type, I know that with RF, it's colorblind. That means I can go as much as the patient can tolerate in terms of pain or discomfort. When to use radiofrequency. So this is also another common question of when patients ask, when is it time to use radiofrequency and when should I use IPL for that patient? So here are some examples. I would say if a patient walks in through your door and you're doing a meibography and you see that there's any type of meibomian gland loss, or you see for example, at the bottom capped glands, you see clogging. If you just press on the glands with your finger and you see this white viscous buttery material come out, or even no production, for example, that means it's completely clogged. Those are examples of when you would use radiofrequency, because you want to deliver the energy a lot deeper at a consistent level to really deliver that energy to target those glands underneath. Another example is chalazions. Chalazions are styes that, after the infection gone, it leaves a cyst or a hard bump. That's a perfect candidate to really break down that cyst, that hardened material, and allow it to express. So radiofrequency is perfect for that. Intense pulse light, and the treatment through that is through the Lumecca eye. It's great because it delivers pulses of broad spectrum light to selective melanin or pigment and blood vessels around the eye and skin region. And the goal is that it promotes photorejuvenation, so anti-rejuvenation or anti-aging rejuvenation of the skin, and does address dry inflammation. So again, there's many IPL devices on the market. Why did I choose Lumecca eye through Envision? I knew that it was front-loaded technology, and that was amazing to learn. And what that means is I've noticed that it's less painful for the patients versus other types of IPL treatments. When the wavelength is front-loaded, you're delivering everything that you need, the most effective component of it, through the first half, and it's already targeting the things that you need. It's very simple. You're not changing through different filters, different hand pieces. It's all in one. And I would say, again, the fact that they have the spot size that's the perfect fit to use around the eye is great. Some areas are hard to get to, like in the nasal corner. This spot size is great for that. It is able to reduce inflammation. Oftentimes we'll see blood vessels or lid neovascularization on the lid margin. It's great at targeting that very fine point. You want to avoid getting too close to the lash margin, but it's so great for helping with inflammation, both that and on your cheeks, and rosacea and pigmentation. And it helps to reduce Demodex mites. So it's able to sort of blast the exoskeleton of the mites and help eradicate it over the 4 sessions. And again, this is when to use IPL. So when a patient you see in the exam room, when is it right to use an IPL on them versus radiofrequency treatment? If you see someone with blepharitis, so blepharitis, you see the collarettes and the scurf around the lid margin, the buildup, this is great because you know that it can eradicate that over time and sort of cause the death of the Demodex mites. And again, lid inflammation, you see the blood vessels around the lid margin from chronic inflammation, you can target those and you see what happens post-treatment. And the last thing is, again, if someone has skin pigmentation and rosacea, let's say they're a candidate for both, but they're mild to moderate, you could either use IPL on them or radiofrequency. The last thing I would think about, if all else is equal, just focus on their aesthetics. What could they benefit from? If someone wants to focus more on addressing pigmentation and freckles on their skin, they have quite a bit and it's prominent, then if all else is equal, I would choose the IPL for them to start with. Or let's say someone has more concerns with fine lines and wrinkles and bags. If all else is equal, I probably would then start with the radiofrequency for them. But if they have a combination of both, I would definitely do both treatments on them. So here I'm going to talk about my protocols for both, and this is just from my experience of what I've done in the exam room, what's worked for me. A lot of it has been trial and error and also learning from other doctors as well, but this has been a way for me to create a starting point across the board for most patients and their skin types. And feel free to use this as well. So I'm going to start with IPL on the left. For my protocol for IPL, when I do my starting settings, I focus on the fluence, which is changing based on their skin type, which we'll go into. So there's skin types 1 through 4, and I will choose the starting point based on that and the joules to deliver, and the type of, I would say, cooling effect. So oftentimes we'll put it on strong, but we may switch it to normal. And the last most critical thing is changing between the pulses, whether it's long or short. But when it comes to technique, this is the way that I would perform the technique. The upper lids, I use the spot size pass, and I go across 2 passes. Typically I deliver, if I count, about 25 pulses across, because after 2 passes it equals out to 25 pulses. I start from the inner nasal corner over to the edge. And then for the lower lids, I again do 2 passes with the spot size right close to the lid margin. I would basically keep it about 3 millimeters away from their lash margin to prevent lash loss. Because we have more glands at the bottom, I would say we have about 40 bottom and around 30 at top, we want to deliver slightly more pulses there, so I do about 30 pulses there. And then we move on to the, we do both sides. When it comes to the tragus, I take off the spot size attachments and we use a regular Lumecca eyepiece to deliver 2 passes tragus to tragus. And typically I might do 2 to 3 pulses until I see a little bit of this gray or ashy appearance or redness or flush skin. My method that I do that has worked for me when it comes to IPL is using a cross-hatch method. So it's just creating either a cross or a plus. So when I deliver and put the hand piece across their cheek region, I usually use it diagonally, and then I go across the second pulse the other way, 90 degrees. So that has allowed me to create this even spread of the energy across and target the areas that I really need. And how do I choose to sort of go up in energy? Basically, per session, after each session, I check in with the patient to see how they feel. And before the start of their next session, I ask the patient what the recovery was and how their skin felt afterwards, their sensitivity level. And from that point forward, I would then bump up to the next level during their next session. When it comes to radiofrequency protocol, this is my experience from what I've tried with the radiofrequency device for the former eye. Again, the starting settings are often controlled through the energy that you deliver, as well as the temperature and the pulse. So energy, I always start around 5. The machine can range up until 9, but I found that between a 4 and a 5 is a good starting point. I actually start on the upper lid on both eyes bilaterally before I move completely to the bottom lids. I keep the temperature consistent at 43 degrees because I know that that's the melting point that I need to get to for those glands to unclog and express. And the pulse I typically may put on repeat. So with the upper lid, I spend slightly less time on the top. Again, there's slightly less meibomian glands up there. And so the upper lids I found has worked for me starting there first, because when the machine first starts, you want to figure out what their starting point is conservatively first and how they feel comfortable, because the tissue around the top lid is much thinner. It's a little bit less, I would say, if it's uncomfortable at all, I would say it's there more than the bottom lid, I would say. So when we start at the upper lids, we shorten it to 4 minutes, and I start at 5, and if the patient can tolerate, every 30 seconds I ask the patient, does this feel comfortable? Can I go up? And then I would bump it up another energy level to the point where I believe they feel like this is a good point, I'm comfortable you doing the treatment on top without having to stop. So in terms of my method or technique, I call it the circle 8 method, and what I end up doing is I consistently move it really quickly in a figure 8 method across, because this way I'm spreading the energy uniformly and it's covering all the surface areas, and at a quick enough pace you're making sure that the patient doesn't feel uncomfortable, so I can actually go higher in energy. So this has allowed me to do that, just moving it in circular motions. I also believe it makes sense because you're contouring, you're following the globe of their eye, and our globe is oftentimes like a half sphere. So following the shape by contouring in circular motions has actually made the experience more comfortable for the patient. And then again, I just maintain at the temperature that's tolerable for the patient. And then when we move on to the bottom, I actually drop it a hair or two below what I left off with the top, because at the bottom, the patients oftentimes can tolerate a higher amount of energy. So let's say if I started at a 5 up top, I could probably start at a 6 at the bottom and go from there. Oftentimes I find that there's only one energy level of separation when I finish. So let's say at the end point, the patient is about, we finish off at a level 6 for the top lid, upper lid. At the bottom, we've gotten to a 7. So next we're gonna go into procedures and see live demos.
Dr. Tsai, fantastic integrated talk for both the business aspects as well as the technology from InMode. We also have a special treat. We're going to have another key opinion leader from InMode, Dr. Bruce Dornn, who has 20 years experience up in Envision in Winnipeg, Canada. He's one of the key principal investigators for the technology, and he's going to have, you guys will have a great repartee between the two, as well as when you do the procedure. So remember, for the live audience, kindly text your questions in, and then Lisa or Shannon will field them and we'll answer them in real time for Dr. Tsai and Dr. Dornn. And meanwhile, we'll do a short transition video for 4 minutes and come right back for the live procedure.
Watery, itchy eyes, if you're experiencing it, you might not be blaming this on allergies. It could be dry eyes, but can you find relief without eye drops? An eye spa in Hudson Yards is using new technology to get to the root of the problem.
The eyes.
There's just a lot of buildup, particles floating.
The windows to your cornea?
Some of that leads to dryness, which is like spots on the eye. Think of it like similar to like scratches on a window.
And the window cleaner for your cornea? Tears.
Most people don't really realize that their tears are made up of water and oil.
But for some, ophthalmologist Jennifer Tsai says the oil production is low.
Over time they get clogged, whether you work out, if you sweat in the summer months, if you put on makeup for ladies. So when they get clogged, you're not producing as much oil, and so then your tears actually evaporate.
Which leads to dry eyes. It recently even landed Mets catcher Thomas Nido to the injured list, citing dry eye syndrome as reason he could not play. The usual solution to this problem, eye drops, but even that has its issues.
FDA released that there were drops that were contaminated over the counter, and they're just normal artificial tear drops and 1 or 2 glaucoma drops. So these drops have caused a few deaths, eyeball removals, as well as just permanent blindness. So it's scary to think that something as easy as just purchasing over-the-counter drops has caused this issue.
At Line of Sight, they're targeting the problem.
So go ahead and put your forehead in.
Without drops.
So this is a meibographer or meibography. So what it does is it uses infrared light to check your glands. So you can see there are like these little long vertical columns of white oil.
I looked at mine.
I did look at yours.
They did not look good.
They didn't look great.
So here's what normal oil glands look like, and here's mine.
But they can get better. We can definitely work on it.
But how do they get better if they can't regrow?
So what we try to do is we had to take away the inflammation.
And that's where Line of Sight's unique devices at their eye spa come into play.
We'll start with the radio frequency because we're going to warm up those glands, get them to sort of heat up, and that flush sort of temperature of the skin allows us to immediately go in afterwards and use IPL to target inflammation and redness.
Does it hurt?
Doesn't hurt.
Okay.
So our radio frequency feels like a hot sun massage, and IPL feels more like a light rubber band snap.
Dr. Tsai recommends people do around 4 treatments.
Most people see such a major improvement that it allows them to sort of get back to a normal baseline. So typically we do this for about 5 minutes on each lid, bottom and top, so a total of 20 minutes, quick and easy. There's really no downtime. So now we're going to go into IPL. This is to sort of protect the cornea and the eye itself. So you're going to close your eyes. What it's allowing me to do is deliver controlled, intense pulses of light.
Once your dry eyes are sorted, you can dress something else.
And last but not least, what I came here for, how to make my eyes brighter, bigger, and whiter.
Yes.
I recently saw some ads for a prescription eye drop called Upneek, which makes your eyes appear more open.
This drop helps to lift something called the superior levator muscle that's in our superior lid.
Tired, sleepy eyes, be gone. something else you can try at line of sight.
The drop works with just putting in one drop, beginning the day, lasts about 8 hours.
And of course, I tried, but just in one eye.
But how was this here before? I think I caught you. No way. Were you just pretending?
No, that's what I look like. Just tired. My eyes are like, that's normal.
But look.
That is actually, I just laughed so hard because it's just so funny. It looks like it was edited. Somebody did some like photo editing on that.
That was crazy, right?
You could totally see a difference. You're like a cyclops.
I know. I went to lunch after that, and for the whole lunch, someone was like, "What's wrong with your other eye?" And it was my normal one, which they thought was small and something wrong with it. But anyways, the
But
drops
you need
are crazy.
prescriptions for those
You do
things.
need prescriptions for the eye drops, along with talking about Dr. Tsai. And this is why you haven't heard about this, because she's one of the first practitioners to use IPL for eye care in the U.S. So it's still very new, but she's great at her job. And PSA, if you have not gotten in your eye check, your annual eye check yet, go do it. I feel like we forget about these things over the years.
I got so many things that need to be checked these days. I don't even know where to start.
Your
But I'll
eyes.
put the eyes. The eyes are very important. I don't like to fool around with the eyes.
I'm just going to walk around with one big one for the rest of the day.
Did you put them in today?
I did. I did.
Your eyes look so big.
then the drops are working.
Welcome back to Dr. Tsai's office here in Hudson Yards, New York City. Once again, we'd like to remind our live audience to type in their questions as needed. And a special treat at Dr. Bruce Dornn in Winnipeg with Envision, with 20 years of experience in optometric health care. Anyway, we'd like to thank Dr. Tsai's patient most of all for being part of this. So, Jennifer, please take it away from here. And Dr. Dornn, can you hear me by the way? Okay. Fantastic.
I think I can hear. Hello? Yeah. I'm just checking to see if I can hear Dr. Dornn.
Yeah, I can hear you.
Okay, perfect. Okay, awesome. So my patient, Sarah here, she's been with me for a couple of years, and the issue that she has is dealing oftentimes with blepharitis. So for her, when she initially came in a few years ago, we noticed a lot of scurf and collarettes on the surface of her lid margin, a lot of redness around the lid margin as well, and some pigmentation around her skin. So we wanted to address that area and target it with IPL treatment. So she's done a few treatments with us, I would say, regularly, and we've done maintenance over the past few years. So I would say a good schedule for what we found is post-treatment, we've been doing single sessions about like 4 months apart. And that's allowed her to get to a point where we're maintaining and keeping the blepharitis and the lid inflammation away. So, and it's also helped with her dryness. So what we're going to do is show you guys how the process works. And Dr. Dornn, I know that you also have different approaches to the treatment and the technique. I would love like your feedback, and we can sort of go through this together.
Great, great.
Awesome. So I have my prep kit of what I use. Typically, you'll want a shield for sun protection if you are the one delivering the treatment. And she's already prepped her, so I use any type of like facial wipe to remove any makeup in the areas that you're trying to treat, both the top and bottom lid and around across the cheek. And to start, you always want to have your gel to use, and you want to make sure that it's clear for the ultrasound gel, and then a paddle to use. You know, you can actually find this on Amazon. This is what I use. I like it because it's you can clean it. It's made out of silicone, and it's very comfortable on the patient across their skin. And for her, because of I would say the anatomy of her lid margin, we want to use. I have different 2 ways to use a shield protection. For IPL, you always want to make sure that you're providing protection from the intense light. Now, you want to make sure that their contacts are out as well. So this is a sticker you can use to protect their eye, or you can use a shield version. I know that Dr. Dornn, yours is like a flat version that you use with a silicone plunger. Here I have one with a handle to take it out, so whichever method that's preferred. Oftentimes, I honestly just choose it based on her lid anatomy, I would say, because there's shorter distance between her lid margin and her brow. I probably wouldn't be able to use this effectively, and because I know there's blepharitis on the surface, I want to get as close as possible, maybe 2 or 3 millimeters away, so I'm going to go for the shield for her. What do you think, Dr. Dornn?
Yeah, I love using the shields because it gives me just better access to the upper and lower lids. So I do use a smooth shield with a plunger. I find that it's just a little bit more comfortable for patients. And I always make sure that I put some gel underneath the plunger or the scleral shield, because it kind of floats off the cornea and it's very comfortable to the patient.
Yeah, definitely agree. There's different size shields that you can use. I also, want to lubricate the surface with artificial tears so that's more comfortable for the patient. So preservative free is probably what you want to go for to keep the surface safe. And here's and more comfortable. So just use a few drops here, and we're going to put both ends. So I'm going to have you look down to your toes and just try not to squeeze. Hold the top lid and you just slide it in and have her look up, and we let it sit there. And then we move on to the second. And same thing, look down. And look up, and it's in. So once that's in, we want to cover the surface with the gel. And I think, the more you use, the more comfortable it is for the patient. And we want to cover it evenly, especially in the areas that you're trying to get to. Here. And cover both sides. And turn towards me. And a little bit there as well. So oftentimes, when patients do start treatments, they may want to do full facial, full aesthetics. And it just would be easy to cover the entire face and go across to do the complete face. So now that that's covered, we can start. Put that here. And then we'll go into settings to decide for her. And we're going to pretend that this is, her first session or her first treatment. Dr. Dornn, what would you use for her? As we can do a.
Well, I look at the I would say I would probably start around 12 to 14 joules as the starting point, and then each subsequent treatment I would try to go up in energy to get the best efficacy.
I would definitely start it around there too as well. So right now my spot size, it's chosen on the screen. I know you guys may not be able to see it, is focus on the small light guide. And then the fluence, I have it set at 14. And for the cooling, I'm keeping it as strong. And for the pulse width, especially around the eye region, I'm going to start with long. And eventually, maybe when you get to the fourth, you could switch it to short, depending on how the patient reacts. And again, you check in with the patient afterwards to see at the next session, can you go up to 15 and then 16. So we're going to start, you turn the machine on, and we're going to start with her eye region, then we'll move on to her tragus. So here we go. So what I like about this is that it's very practical and easy to use around the eye. Because of the narrow region there, I typically might just lift it up a bit so I can get across. What's nice about the machine is it cuts off at 30 pulses, so it helps to guide you without having to focus on looking at the device. So we'll start on this side. 3, 2, 1. And always check in with the patient. Is that okay or comfortable? So we just wait a few minutes to see if there's any reaction, any flushing of the skin, and then we can go across. When it comes to pressure, I wouldn't press too hard. I just want to make sure that you maintain full contact. And I finish at the lateral canthus. So that was about 13 pulses, and that was one single pass. I'm going to go through with a second pass on top. Is everything okay? That was about, so just naturally, it got to about 25 pulses. That's what I've noticed has been the amount for me to sweet spot to get across both bilaterally. But the machine does stop at 30, so that you're aware when it hits 30 that you can either reset it or you stop where you finish. So that is the top, and I'm going to move down to the bottom. And we get to the bottom component of her lid region, same thing. About here, I'm delivering a little bit more because, again, we want to really get to those glands underneath, and she's going to have, when we checked, we saw a little bit more blepharitis in the bottom for her lids before. 1 second. And I know, Dornn, you do it a little differently. Do you start with one eye and then move on to the other?
Correct. I'll usually do the upper and the lower lid on the right side.
Mm-hmm.
Then I'll do the same upper and lower lid on the left side.
Mm-hmm.
And then I just repeat that. But I'm doing very similar to what you're doing. I'm doing 2 passes on both eyes with a scleral shield in, just like you're doing.
Yeah. The scleral shield is great because you're able to get really close to that lid margin. But depending on the patient's aperture, you may want to switch to a sticker just for ease and comfort. Okay, so there I got to about 30 when we finished with the spot size treatment. What I really like about this device is that it's very easy to just switch off and focus on the rest of the face without having to like detach and reattach the device and change the filter. So just simple enough, I take off the spot size tip and I'm ready to go. So now I am changing my treatment to the main headpiece, and the energy that's delivered, you lose about 25%. That's why you go a little bit higher for the spot size on the eye, but we're probably going to drop this down. So if we started at 14 as her first time, then we'd probably drop her down to about 12. And Dornn, do you agree? Do you do the same amount?
Yeah, what I really like here is when you're using the spot IPL, very safe to use on the eyelids. You've got access all the way along that lid margin, and you can get to where there's blepharitis, Demodex. And then taking this off, I do a very similar procedure where now I'm using the larger, the rectangular crystal, and I can do the cheeks, where a lot of times you're going to see patients with a lot of rosacea, and you can address that as well.
Yep. And so this is one way I'll do it. I'll go crisscross, or sometimes I'll do a plus, so across the cheek region. And you're going to turn towards me so you can get across to the other side. And then you just go straight across to the other cheek region. And covering that surface. And it depends on the patient's bone structure. She has higher cheekbones, so for her it may be easier to go across horizontally and then crisscross it vertically. But for someone else, it just depends on the contour of their face. So we went across, and now we're going to do a cross hatch this way. There you go. And the goal is to make sure that the skin is a bit flush, or if you're targeting pigment, that you see this ashy pepper change in the pigment. So we're going to move on to this side here. And turn a little bit more towards me. There you go. And sometimes, usually I may do a third pass just to see if I notice any change here. So she's just a little bit flush. And here.
I have a question for both the doctors. Do you expect a level of erythema as a proof positive, if you will, of the treatment in Fitzpatrick types? Do you like to see the erythema afterwards?
Yes.
When we use the Lumecca for other cosmetic indications, we definitely want to look for that.
Yes, definitely. Okay, she's done. So we're going to take out the shields, have you look up, and easy to pop out. We remove the gel on her face, and
She's an amazing patient, but I would imagine that it's a
did
very
great.
comfortable procedure for all your patients. Do you pre-medicate or do anything like that for any of the more nervous ones, or they
you know the
tolerate
nervous.
well?
Sometimes patient comfort is actually the most important thing, because if they're not comfortable, you're not going to be able to deliver an effective treatment for the patient. So let's say she was really uncomfortable with the idea of doing that, we might use a sticker instead, just to start there, and just let her know, like, you know, we're starting here, but the next session we may graduate you to a shield so that we get more effective results. So we start our lower energy level, the fluent, so that she's more comfortable with it as we move her on. And usually once they have the first experience with the treatment, they understand what they're doing and they're way more comfortable with it for the next one.
Bruce, regulatory-wise in Canada, are there any substantive clinical differentiations between down the lower, below you guys, or in the health one Canada? Is there different stipulations that may affect your clinical judgment or decision process, I should say?
It's a little wet. You did great. Okay. Good. Okay, so
At this point, we might transition to the next room to Dr. Tsai will demonstrate both what goes into her thought process and consultation, as well as a different procedure, extraction as well. And she utilizes a slit lamp device, which has a really cool image as well. So we're going to take a short break. Don't go away, and please, for the live audience, remember to type in your questions that we can answer in real time. And we'll be back with Dr. Tsai and Dr. Dornn. back in Hudson Yards, line of sight, Dr. Jennifer Tsai's practice, Dr. Bruce Dornn calling in from Winnipeg, Canada. And Jen, what are you doing in your second room here with your slit lamp device?
So immediately after the delivery of the pulses, it's just enough temperature and heat to melt those glands that are sitting underneath the dermis layer. So we want to go in and express it. So this is a tool that we use and has a flat edge forceps, so we're able to go through and express each column of the meibum, the glands sitting underneath. So I'm gonna show you guys. So here you can see when we refer to lid neo, you can see right here on her lid margin, there's a little bit of that blood vessel growth. Look down to your toes, and you can see we've cleaned up most of her blepharitis, but you can just see a little bit of the collards in the scurf, but very trace. So I'm gonna start with the bottom lid, look up to the ceiling. What we'll do is typically I'll pull down the bottom lid, and I start on the outer edge, and we'll just express. And you should be able to see that coming out. And you want to hold it so that it's getting that consistent, confirmed pressure to get those glands to express. And in some areas you might notice this thicker type of production versus some areas it's more liquid in form. So right there, we're getting that to come out. And definitely right in that corner there.
That is very satisfying.
Call me Dr. Pimple Popper. And right there, you see. Okay.
When I saw Dr. Dornn's presentation the first time, and it was very impressive as well, but seeing it live is even more fun.
No.
We also have a question that Lisa can field from the audience if you have a moment.
Sure. The first question is, are you performing RF and IPL on the same day?
Oftentimes I do, and I think that it's an easy, great way to deliver more effective treatment, because right after the other, you're building up that energy and reducing that inflammation. So it depends on the patient, the severity level, and their skin type. Oftentimes, if I just see, they have overall inflammation of their eyes, I would definitely switch to doing a combo, which we'll show later. So here we're finishing up the bottom lid. And I noticed that on this side, we're actually getting a little bit of, a little less expression here, just towards the ends we're getting some. It's also great because when we do this, it's a very, very critical step, because it allows us to know for the next session, do we need to go higher? Are we really resolving the issues? We base it on quantity and quality of the production. Look down. So if we're seeing that the production is still yellow in coloration instead of clear or white in fluid, then we know that perhaps we need to go a little higher. Or if we see that the glands are still pretty clogged and we're not getting the results that we want, we can probably adjust our temperature and our treatment plan protocol for their next session. Go ahead and close your eyes.
The topical analgesic was all you needed here?
Yep, so if you already put in the shield and we do the treatment, normally we wouldn't need to put in another anesthetic. The drop can last about 5 to 10 minutes. Look down, and then we'll just finish up here.
And for those of us who are uninitiated, your endpoint is until you don't express any more material?
The goal is to get to a point where she's producing nice, clear fluid, transparent fluid, instead of this thick meibum or viscous meibum that looks more buttery in texture or yellow in coloration. So you judge it based on the color and then also by the type of production.
Can you talk about the image here? The image is really nice. What are you using to capture? Obviously, is attached to your slit lamp.
So our slit lamp is by Zeiss, and this is SL800, and we have the software connected to it, which allows us to, in real time, image and record. This is a great tool because you can show the patient exactly what you're doing, which has been also very great when it comes to showing patients like what exactly you're doing for them to understand what's actually coming out, and patients actually really like seeing it too.
Yeah, it's very satisfying.
Yeah. Okay.
So we have a couple more patients, and we're going to do another talk. We would love to hear from the ROI. Dr. Dornn, any other comments currently? I'm not sure if we can hear you. I may can hear you, Jen, if you ask.
Hi. Dornn, are you? Not sure if I can hear him.
Hi, I can barely hear you here. Okay.
Yeah. So we're saying, is there anything you'd like to add, or anything that you've noticed during your experience treating the patients post for expression?
Yeah, some of the things that I like to do, I like that you're using the forceps. I think there are some optometrists out there that are just pressing with a Q-tip or something. I think the forceps, the paddle forceps, work much better, more effective for the expressions. And one of the things that I've started doing is I use surgical loops. So it just kind of frees up my hands. I can come in, I can do this, whether there's a slut lamp in the room or not. That's really been helpful to me. And I think it just helps you if you're especially doing upper lids. The surgical loops are just make it a little more user friendly.
Terrific. That fantastic procedure here, and we're going to take a short transitional break where Dr. Tsai is going to treat a second patient back in the first room. So please stick with us just a few more minutes. Thank you. And we're back to room 1 at Dr. Tsai's office in Hudson Yards, New York City. Bruce Dornn, Dr. Dornn, remotely in from Winnipeg. Okay, what are we up to now, Dr. Tsai?
So my patient Al, he has meibomian gland dysfunction, swollen puffy lids. He's unable to wear contact lenses and has failed Verstasis, Xiidra, Lotamax. We've tried everything on him, punctal plug. So this, he's noticed a significant improvement, which is using radiofrequency. He does not have lid neovascularization or blepharitis. So for him, we want to choose the radiofrequency. Also based on his skin type, I think that's going to be a more effective treatment because we can go higher in energy. So I know previously that we started him at a 5 in the past, so that's where I'd start. The temperature cutoff is at 43. And I'm just going to show you guys how I do it. So typically I'd start with the top lids in circular motion here. We're going across, following the contour of his top lid. And then when it hits 30 seconds, I check in on him to make sure that he's comfortable. So right about here, are you comfortable? Can I go up in energy?
Yeah, we're good.
Okay. So I like to go up in half steps first. It's at 5.5 and I continue. And what's great is this lets me do the treatment without having to really look. When it beeps double beep is where we want to be. When it triple beeps, that means that area might be a little too hot. But when I do this in a continuous circular motion, it allows me to spread the energy so it's more comfortable for the patient, so it's not too hot in one area. And that's probably good, so we go up another step. You comfortable? Okay. All right, so I would just say, generally speaking, every 30 seconds, I would just go up if I find that it's tolerable for the patient. What's great is the machine, you know, if you lose contact, it does stop and makes a flat beep, and you know that you're not at risk of, you know, burning the patient or making the patient feel uncomfortable.
Jennifer, we have a couple more questions.
This way.
Are you delegating your RF to staff?
RF is definitely one of the treatments that can be delegated. It's certainly something that I enjoy doing, so I still treat the patients, but sometimes when it gets to their third or fourth treatment session, that can be delegated to a medical assistant. But I always like to at least do the first one, so I establish you know, the treatment plan for the patient and the treatment plan going forward for the next 2 to 3, 4 sessions.
And then when do you switch from the 580 to the 515 handpiece and adjust your settings?
So for the IPL,
Yes.
the IPL setting, it's pretty much built into one. You're not changing the filter in the device, which is what's great. You're really just changing the fluence level and the type of cooling effect in short or long pulses. But Dr. Dornn, do you have any feedback on this?
Sorry, could you repeat that question?
He said, can you repeat the question?
I don't know, yeah. Maybe you can repeat the question.
Oh, there's which handpiece for the IPL are you using? There's only one handpiece for.
There's a one hand piece, yeah.
Right.
Mm-hmm.
Yeah, I'm using the 580
And do you
almost
use eye
exclusively.
shields for RF?
For radio frequency, because it's a bipolar tip, you actually don't need any consumables or shields. So you can see that the tip here, it just loops the energy back between the two electrodes. So it's very easy and very safe. That's why I really like it versus a monopolar type of radio frequency treatment. You don't need a grounding pad. So for the bottom lid, I go up 1 energy level higher, because I know that typically at the bottom patients can tolerate a little bit more. And it's nice to see this sort of flush coloration on the surface. Sometimes, depending on their lid anatomy, I may consider just moving it back and forth. And I spend typically about 6 minutes on the bottom and 4 on top. And if the patient feels fine, again, I can go up. So right now I'm already at 7.5. Yeah.
Do you have any potential side effects for RF, such as fat loss around the jowl area?
Well, normally with the contraindications is to make sure that the patient does not have any metal implants or, for example, pacemakers. And now when it comes to face fat, I found that it hasn't been a huge issue. When it comes to, if you're considering doing Morpheus microneedling, you might see more of an effective change, but not with radiofrequency alone. What I do see that it tightens the skin, and it helps with just creating more of an even, smooth texture. And then move to the other side.
Have you used RF for treatment of styes? If so, what's your protocol?
Definitely, when it comes to styes, I usually wait for the infection to be resolved, because you really don't want to start treatment on someone that has an active infection. So normally I would prescribe a antibacterial and steroidal combo, have them come back, and once the infection's gone, we would go into the radiofrequency IPL combo. Dornn, do you do the same? What you find?
Yeah, we do radio frequency on virtually every patient, and I think it's very safe and very delegatable, and it's one of the things that my staff love doing. So I do delegate RF to my staff, and it just saves me time. If I'm busy during the day, it's so safe that I can get them to do it for me.
And so if there's extra time to spend, I usually like to spend maybe 1 to 2 minutes right here, which certainly helps with like fine lines, wrinkles, crow's feet. And finish up.
While you're completing the procedure with the gentleman, could you make some comments on some photos?
Yeah. So when it comes to images, here we have an image of him. I think it's on a different image. Yeah, so here we see him. Previously, he has definitely swollen bottom lids. There's edema and redness. And right in the middle, you see the capped glands and clogging. So this is a perfect candidate where you would do the radiofrequency treatment on, because you can already tell that there's a bit of the clogging when it comes to the meibum. And then when we did his meibography on the far right, that's a big giveaway. We see a lot of truncation, truncated meibum. The columns there's a few areas where the segments are gone. Typically what you might see when it comes to the meibography images is if there's either shortening of the entire column, or you may notice segmented truncated loss. So either type of situation you see, you would want to do a radiofrequency treatment on the patient.
You want to comment to this patient also?
Yep, so that's the next patient that we plan to treat with a history of chalazion and rosacea. So what I'll do is have my assistant finish up the radiofrequency treatment on him, and we'll start on the next one.
So we'll take a short break again, and we'll have a bonus patient where it's a combination patient. I think we should stick around for that for Dr. Tsai's treatment. So please stay tuned. we're back in Dr. Jennifer Tsai's office in Hudson Yards, New York City. Dr. Bruce Dornn commenting from Winnipeg, Canada. And we're at Dr. Tsai's third and final patient with a combo procedure. What are you going to have in store for us?
So she has ocular rosacea as well as rosacea, as you can see across her cheek. And previously treated because of chalazions. She had recurrent chalazions that she kept coming in for. So ideally for her, a combo treatment would be great. Typically, I start with an IPL followed by radiofrequency. So I'm going to show you how I'll continue. We already finished the top and we're going to move on to the bottom with the spot size. So here, I would say that she's a skin type 3. The setting is on 13 fluents. Strong for cooling and the pulse will be long. And again, this can be increased over time as her sessions go on. So usually we go across with 2 pulses and then we'll move on to the larger handpiece. And bottom here. Turn towards me a little bit. Great. And then we go across another pass. A great way to control your patients is to have them turn, and you can guide them by their chin so that you're getting in the areas that you want. And again, we're getting about a total of 30 pulses across, or on each side. And now we're going to move on to the cheek region to get across the areas where she has rosacea and telangiectasia. So we're going to drop this a bit again, assuming that this is her first treatment. We're dropping about to 11 to 12. We're going to keep the cooling at strong and long pulse, and we'll change the spot size and we'll go across. So based on the way her cheek formation is, what we can do is go across in a crisscross method. So here we're covering the entire region. And about 20% overlap is fine. And then move, and we'll have her turn this way. You can see that she's a little bit flush. We go across second, and I'm going to lay it horizontally. Probably do 2 to 3 rows down and then across. And here. And we're almost done. Okay. And then we'll move on to radio frequency. So this part's easy because for me, once I start the IPL and the gel's on her face, I don't have to take it off. I immediately just take off the shield for her and I can lay her flat and finish the rest. So we're just going to immediately move on to that's why I like using the Envision device, because it allows me to just simply switch between the two.
That's a testament to its versatility. I mean, in one box you get all these different treatment procedures, I think, and they're all best in class, would you say?
Yeah. And sometimes the question is like, do you do radiofrequency first or the IPL? I have tried both on the patient. I find that generally both ways do work, but I've just preferred to start with the IPL first in case with the radiofrequency, if their skin gets too hot, we want to make sure that the patient doesn't burn. But sometimes if it's a patient with inflammation, perhaps you might want to start with the radiofrequency first to get those blood vessels dilated. So again, temperature cutoff, I'm switching it to 43, and we immediately go into the treatment. So again, I start at the top and go across.
I find the patients really enjoy the former. Actually, I do a lot of body contouring and for post lipo things, and the RF technology is so universal. I mean, you're doing a very specific ocular kind of indication, and we use it for cosmetic things, and it's really a universal kind of application of energy.
Right. And it's great because you can be able to deliver that combo treatment for the patient. And immediately when you go into the expression, you'll see that a lot of the myelin has come out from the combo. It's very effective. So I'll just show you guys what we would do for the bottom. Same thing.
Our production team appreciates your southpaw, which is great with the angles.
Okay, and then I can have my assistant finish
Great.
in between.
Terrific. For the audience, we really want to stay tuned for Dr. Tsai's wrap-up slides. It's a wonderful summary, and her unique approach as a force of nature in social media, as well as a national speaker. Dr. Bruce Dornn as well as a national speaker. They have different approaches, and we'd like to hear from both of our experts and how they promote the practice using this technology. And I think we're in for a real treat at the end of the wrap-up of this episode. So please stay tuned. We're going to do a short transition, and Dr. Tsai and Dr. Dornn will wrap up.
the demo, the live demo is very helpful. We're going to go into conversion tips. Is there anything you'd like to add?
No, please take it away.
Sorry. So I wanted to focus on I guess, wrapping up the most important piece of the puzzle is how do you know how to convert the patients in the exam room? Because that's the most critical part. Learning how to speak about the treatments, provide the information, and convert them into a treatment, the next procedure. So as you guys know, I started my practice about 2.5 years ago. And every patient that comes in through the door is a new patient for me. And they oftentimes are coming in actually for just a comprehensive eye exam for a vision test. So how am I able to convert 75% of them from first consultation comprehensive visits to booking a procedure for their next visit? I'm going to explain why and walk you through the process. So the first thing is you want to ask the right questions during the history taking. I know that there's forms that patients can fill out about their patient history, asking if their eyes water, tear, or if they turn red. But it actually takes sitting in the exam room and having that conversation with the patient and asking them in a way that sort of sparks that conversation. So for example, if a patient comes in and they're wearing contact lenses all the time, I would ask the patient, do you notice that at the end of the day when you take out your contact lenses that your eyes feel more irritated or they start to water or turn more red? Oftentimes patients will say, my eyes feel perfectly fine in contact lenses. If you ask them if their eyes are dry with contact lenses on, they'll say it feels just fine. But the contact lenses acts much like a Band-Aid on the surface of a wound. You're not going to experience the sensitivity once it's covering the surface of the cornea. So another example is asking patients if their eyes water a lot on a cold or windy day when they're outside. A few other questions you can think about is, do your eyes feel like they are uncomfortable when you first wake up or at the end of the day? Or do you feel like you wake up in the middle of the night sometimes when your eyes bother you or you feel like they feel painful? So those are oftentimes examples of that. Asking them questions about having LASIK surgery or any previous infections. I also notice during the slit lamp, if I look at their lid margin and I see that it's very irregular, I can tell that there's an area where they had a really nasty sty or chalazion that was not addressed, and we've sort of lost that bucket or that column of oil. And when we bring up that conversation, it sparks a conversation for doing imaging and therefore considering treatment. Also doing a 10-minute dry eye consultation integrated into every exam, super important to do that. Again, every patient that I see is a full exam. Again, they're not coming in for a dry eye consultation most of the time, they're coming in for an eye exam. But we always dedicate 10 minutes after the slit lamp check to see what's going on. I usually stain the patient, do my biography, and have that discussion before we put in contact lenses. And so you want to build that into your exam. Usually everything else can sort of be adjusted in the front half before the patient checks in so that the time in the exam room is more seamless. Using diagnostic imaging. So the tools that are important, very critical, are images. I mean, it says a lot when a patient can see their own image in real time. If they see staining and you show them staining on their corneal surface using fluorescein as well as meibography, it's a very amazing tool because you can see changes in the meibum and you can show it to the patient. What I like to do is just Google images and show them what normal meibomian gland image will look like and what theirs is in comparison to that. And usually when you can show them that, they really understand the importance of why they need certain treatments. And including analogies during talking points is so important because, as doctors and professionals, we know what these words mean, but for patients, they don't really understand. You need to give them an analogy, and oftentimes I'll use teeth as an example. For example, if we lose a meibomian gland, there's loss there. It's like cavities. We lose a tooth, it never comes back. We don't ever want to lose more glands because we don't grow more glands. So it's very critical for us to address what's happening now so it delays any further issues in the future. And then also sharing real-time images of them and how they've improved over time. Patients like seeing that after the first, second, third, fourth treatment, there are some results. And when you can sort of show them the before and after of themselves, it really helps them understand what they're doing and why they are considering these treatments for a longer-term solution. Giving them a range of treatment options, I would say, last but not least, this is the most critical part. You never want to be the person that decides for your patient what the best treatment is for them. You can tell them what you recommend, but it's up to them to decide. And I think as professionals, it's our job to give them the range and let them decide if that's the treatment that they want to go for. If they're not ready right now, no problem. You've discussed it with them. They are educated. They can learn more about it. So if you see them back in 3 months and things have not improved with drops or punctal plugs or warm compresses, then they'll be ready for that treatment and you have already sort of set up that patient for treatment and for successful gateway into the treatment. So giving patient treatment options is very critical because you're letting the patient choose. And again, it's not up to us to decide what the patient should get or do, but it's up to them to have the options to choose from. But you should offer your best recommendation to the patient, why you believe that this option is the best in comparison. I want to bring in Dr. Dornn, and see if he has any conversion tips in his exam room as well.
Hi.
Dr. Dornn?
Yes, I can hear you.
Yeah, I just want to see if you have any conversion tips for you, what you notice works in your practice when you're seeing patients that you've noticed helps to turn that patient from a normal exam and converting them into a treatment.
I think one of the things that's important is explaining to patients the importance of tears, because I don't think a lot of patients understand that. So I always try to explain the tears are important because they absorb oxygen and they're feeding oxygen to the cornea. I talk about how a single drop of tear has over 1,500 antibodies, and that's how we protect our eye from constant infection. And when patients come in and they have constant chalasia and they have blepharitis and Demodex, the reason for that is they're just not producing enough antibodies into their tears. So dry eye has serious ramifications in the health of their eye. So it's important that they understand the importance of tears, and then I try to combine that with images like meibography, where you can see the gland dropout, and now they see that there's gland loss, and these glands are important, and they've got to maintain the health of their meibomian glands for the entire course of their lifetime. So I think they're a lot more motivated when they see those two things in concert.
I agree, motivated is the right word that we see in patients. And I think also, previously we discussed previous slides about how there are drops, artificial tears, but it's like, again, putting lotion on your skin. Or if you use Restasis or Xiidra, if you show them the image of their glands or you show them the blepharitis, now they understand why the drops aren't actually targeting what they actually need, which is oftentimes happening on the lid region. And there's really no way to address that effectively but using radiofrequency and IPL treatments. And so again, their images speak for themselves.
So
right, and I think one of the things that they have to understand is 85% of dry eye is really just a blockage. And RF is extremely important to kind of mitigate that and try to get rid of that blockage.
Dr. Dornn speaking. Okay. Yeah. Thank you. Sorry. Can you repeat that one more time?
What I was saying is, I think one of the most important tools we have with Envision is the RF. I think the RF portion of what we're doing is really addressing those 85% of patients that have MGD.
Right.
And so I think that's been the real game changer in my practice, is having that combination of RF for every single patient and also the augmentation with the IPL.
I totally agree. And I think there's a question that someone had in the audience.
Sure. What are some great first steps for physicians who are resistant to social media? Where do they start?
So the question is where to start if you're resistant to social media. You mean the doctor is resistant to social media? Yes. Honestly, hire someone. Hiring someone that you know is good. And me hiring someone, because I've done social media, has been tough because I kind of know what I want to see and what I expect. But what has worked for me is actually, it's hard to judge someone's creativity and work and what they're able to produce because everyone's style is different and approach. But if you ask, when you interview, you ask them to create 3 draft pieces of graphic content for you. Ask them what are 3 things that you could think about related to eyes that you could create content for, and then ask them for 3 images that they've shot or reels that are more popular now for them to create a short 30-second reel as if they were working in the practice already. And if you can get the interviewees to do that, you can immediately judge the work and see if they're going to be able to pick things up quickly and understand what you're looking for, and then give them a goal or deliverable. But I would say definitely for me, it's like not having enough time. I would batch the work. So I'm working 5 days, if I'm seeing patients 5 days a week, that extra day, I'm taking all the content that I need on one given day. And so that once that's created over the week, I can spread out the content and have an assistant post about it and upload and engage.
And then one more clinical question. Do you use a 10 to 20% overlap between the small spot size or just the larger without the spot size?
The 10 to 20 percent overlap typically comes to the larger spot size. With the small spot size, you're able to cover enough when you go across. But when you cover the spots, you kind of just see where you're alternating, because again, you go across 2 passes. So you'll make sure that with the 30 pulses across each, you'll cover the entire surface. Okay. So diagnostic tools, we're going to talk about what tools you'll need during the consultation. So again, we talked about targeting, history taking. That's the most important, that patients don't know that they have dry eyes, but it's, us asking the right type of questions in the exam room. Otherwise, if you just say, are your eyes dry, they're going to say they're fine. But we have to make sure that we're asking them the right questions to guide them in that direction. Also showing example-based symptom questions that we've talked about. When you are cycling outside, do you notice that your eyes water a lot? Do you notice that when you wear makeup, at the end of the day, the next day, you feel like your eyes irritate you? Or do you notice that in the morning when you first wake up, it's hard to open one eye versus the other? Those are also signs that patients may not be aware about. Getting that T-butt measurement, tear breakup time, is super important. When you put in the corneal staining, you want to see how quickly those tears break apart. If it's 10 seconds, great, but usually oftentimes we'll find that it's way less, like 5 seconds or even 2 to 3. Fluorescein staining, very critical. Being able to capture that image after you stain the surface to show them, these are dry spots. By the way, this is something that's taken me a while to learn about how to educate patients about dry spots, because they can't really envision what that means. This is what I tell patients. Imagine if you have like a window that you look through, that's your cornea. And if it's nice and clear, that's great. But if you notice that the window's scratched or there's staining on the surface or spots, you can't see that well through that window. If you can't see that well through that window, no matter what prescription I give you, it's not going to improve the vision. We need to clear up that window. Another great analogy is saying, in the winter when your skin's rough and patchy, you feel these little bumps on the surface. And that's exactly what it looks like and feels like on the surface. If that doesn't feel good on your skin, it certainly doesn't feel good on your cornea. Meibography, again, very critical tool, because you want to be able to image the glands and see how much it's improved, and also show the patient as well where their baseline is compared to others. And lid margin imaging, so being able to take a close-up shot of those blood vessels that are leaking inflammation by the lid margin, the close-up shot of those Demodex, the mites, and the blepharitis on the surface, and showing it to the patients and showing them this is what normal looks like. Oftentimes patients can't see the top of their lids, right? They cannot see what's going up on the surface. So with magnification, you can show them the slit lamp. It makes a huge difference. I'm going to go into pricing. So for pricing, we're going to talk about what I charge for dry eye consultation, and then the individual treatments, and then the package. So I schedule patients for a dry eye consultation unless they've already had a routine exam, and like I said, that 10-minute consultation is already baked into each exam. But if a patient comes in separately, whether through word of mouth, if they heard about our treatments and they're looking for a second opinion, that patient comes in as a dry eye consultation. That's $125, which includes the meibography and all the measurements, the slit lamp exam, and the discussion. If the patient does go into treatment, we do waive the consultation fee. A single session of RF, if they do it by a single session, it's $450. If a patient does a package of 4, it's discounted to $1,600. For IPL, we charge $550, and for a package of 4, it's $2,000. Now, for a combination of radiofrequency IPL, ideally for patients who, that are either very symptomatic, or you feel like there's severe, signs of dry eye conditions on the surface, I would definitely do the RF combination if they have a Schlesian or any type of autoimmune issues. So the package is $850 for a single. A single is $850, but for a package it's $3,000. So oftentimes the question is, how do you get a patient, instead of paying for a single session or just doing 1 and dropping off, how do you get them to do the 4? Usually I just very simple tell the patient, based off the studies that have been done and the research and what my personal patient's experience has been, they end up doing the 4 because each session they notice an immediate improvement, and each treatment builds on top of itself, because we need to target this disruption of the homeostasis, this inflammatory cycle. It takes time to get through that, and that requires the treatments to be spaced 2 to 3 weeks apart, 4 sessions for completion. And I let the patient again decide, but I do tell the patient most of the patients end up doing the 4 anyway, so they already pre-booked the 4, and that's, I would say, 90% conversion rate for patients for me to do always the package instead of the single because they save more money. It's more advantageous for them. And the last thing is adding the facial add-on for any patients that wants the aesthetic benefits of the IPL for pigmentation or redness of the skin. We add $100 to the treatment package for each session. And if they want to focus on radiofrequency for the smile line or 11s and any additional areas, we add 100. So I'm going to bring in, I guess we'll bring in Dornn and see. I know that he's practicing in Canada and the rates are a bit different, but do you do similar sort of packages or single sessions?
Yeah, I do a very similar kind of pricing package. A lot of my patients, I'll tailor it to the severity of their dry eye. So in a lot of cases, I may do 4 treatments rather than 3 treatments. And but I do, a lot of my patients get the RF IPL combo because with dry eye, I look at it as being, there's a blockage and I want to deal with that. And RF is very good for that. But there's also an inflammatory component. And so if I can, if their skin type is appropriate, I'll try to always do the RF IPL combo, and I find I get the best success by doing it that way.
Great. Yeah. Move on. Oh. Okay, we're going to talk about ROI. This is probably the most important thing, aside from helping patients, making sure that we make them feel comfortable and they're happy and satisfied with their treatments in your office. But it has to make sense, right, for your practice. And if you do the math, this is what's worked for me. And I think depending on the area that you're in, guaranteed you're going to get to a point where the machine pays for itself, in a couple of months. So, of course, it doesn't start with 4 to 5 patients. I started from 0, but quickly I was able to get it up to 4 to 5 treatments a day. And that adds up to, let's say, like 20 patients a week. And I took the average of, let's say, the radiofrequency single sessions and the IPL sessions and the combo sessions. And if you say the average, that's around 500 to 700 per treatment, depending on the variation. Now, if you take that number and you times it by the amount of patients you see, that's bringing in revenue of $58,000 per month. And if you times that by 12 in a year, that's $700,000. And that's me just bringing on this device in 6 months' time. And again, being able to stack the treatments, doing a combination is amazing. So I would say for being able to generate that much revenue, it's also helped me because instead of having to carry a lot of frame inventory and a lot of other devices that don't necessarily bring in immediate cash-based treatments, I'm holding inventory, and it's allowed me to sort of bring in this other stream that's allowed me to sort of create a better working capital flow as well. And so last thing I want to share is just thinking about it. So, every patient that comes into your room, let's say you see about 10 patients and in your exam, at least 8 of the 10 have dry eyes. And whether they know it or not, we know that the amount is at least 80%. And now, even if you just have 1 package per week that you've done, you've already profited. In terms of paying off the lease per month, you've already even gotten to a point where you've profited from the device with just 1 treatment, 1 package treatment per month. And we know that you're going to get way more than that if you have 8 out of 10 patients, again, that have dry eyes every single day sitting in your exam room. What's also helped on a bigger scale is that it's built meaningful relationships for me with my clients. I'm sitting in the room, I'm learning, and I'm spending actually more time talking to this patient, building better quality relationships and conversations with them. And that's actually brought way more patients than I ever imagined because they're telling their friends, they're telling their coworkers, they're bringing in, family members who are traveling across. And what it's also helped with is us naturally talking about other types of treatments that we offer, like Morpheus, and how there's various other types of services that we have and products that we sell because of that conversion rate. The spillover effect. What that means, my terminology for that is just maintenance and add-ons. After the 4 initial sessions that I do for the treatments, we check to see where they're at. I see them back for typically or follow up within 1 to 2 months. If they're more severe, we feel like we've gotten to 90% but they're not complete, I'd like to see them back in a month and just reevaluate to see what the protocol is for their maintenance, and we'll decide together during that time period. So if someone is more mild to moderate, typically the protocol for me would be every about 6 months I would do 1 single session or a combination package. If I find that they're more moderate to severe, I would probably end up doing it every 3 to 4 months apart, which is great because patients, again, come back for their yearly exams. They don't miss follow-ups. They come in and they look at eyewear. They purchase other services and treatments that we do. And it's just been a really great way to generate additional revenue to help, build your practice. And reinvesting in your business, not insurances. I mean, this took me a while to learn, taking insurances and, feeling like I have to use insurance to help the patient, and feeling like I feel bad saying that this is a cash pay treatment. And I know we've all been there, but when you reinvest in your business, you're actually giving a better outcome and quality for your patient. And that's what I started to realize. I don't want to use something that doesn't really work that well just because it's something that's covered. I want to give them the best so that's a longer term solution, so that they're not dealing with the problem, so that they're happy. And so I don't want to reinvest my dollars and my money back into the pockets of insurance companies. So again, a few takeaways. I took the leap of faith, and I hope you do too. It's very rewarding. Make social media work for you. You can use it as a great way to grow your patients organically and get referrals. And the last thing I want to share is that opportunity is now. It's not tomorrow. It's not next week. We all get busy with our schedules and we think about it next month. And technology and everything else moves at a fast pace. You want to jump on the opportunity now. So thank you guys for joining me. That's all I have to share.
Dr. Dornn, Dr. Tsai, on behalf of the clinical team for InMode and Brave Makers Production, that was a hugely informational block of information and procedures. I don't think we ever done 3 patients before, so very efficient.
Nailed it.
Anyway, yeah, nailed it. So, Dr. Dornn, any other questions? But we like, for the live audience, we'd like to remind that there will be a InMode event in Brooklyn next week where Dr. Tsai, among other speakers, will be speaking. Dr. Dornn will also be appearing in future InMode events as well as key opinion leader and national speaker. So without further ado, we would like to thank everyone, and we'll see you at the next one.